Well, hello there, future nurses. Welcome back to Med Monday. I'm so excited to get this series started again, especially just in time for summer. So let's jump in and get started. Our medication this week is Mapyridine. The trade name is Demerol. The functional class for this medication is opioid analgesic. This medication can be given PO, IV, or IM. It works by depressing the impulse of pain in the CNS and smooth muscle organs by interacting with those opioid receptors. Now, treatment for overdose of this medication includes naloxone, airway protection, supplemental oxygenation, IV fluids for hypotension, and vasopressors if the IV fluids don't work. Indications for this medication include moderate to severe pain. It is also used as a general anesthesia maintenance medication, and this medication is also given postoperatively for shivering, and it works very well. Contraindications include hypersensitivity, respiratory depression, new MAOI therapy, and known or suspected gastric obstruction or paralytic ileus. Side effects, remember these are non-life-threatening, but we still want to monitor for them. They include drowsiness, dizziness and confusion, bradycardia, hypotension or tachycardia, nausea and vomiting, constipation, and urinary retention. Now, our adverse reactions, remember these are life-threatening, include, as always, anaphylaxis, serotonin syndrome, respiratory depression, and bowel obstruction or paralytic ileus. This medication does come with a black box warning, and that includes monitoring our patients for co-administration with other CNS depressants and for respiratory depression. We want to make sure that we are assessing our patient's pain, location, duration, intensity, and characteristics before, during, and after administration. We want to make sure that we're monitoring our patient's heart rate, respiratory rate, pattern, effort, as well as the blood pressure. We want to monitor for confusion, especially in our older patients or opiate naive patients. And we want to monitor our patients' hepatic and renal function. Other nursing considerations include monitoring for serotonin syndrome with SSRIs. We want to monitor our patient's bowel function because this can cause constipation. We want to monitor our INOs for urinary retention. And we want to make sure that we're not administering this with MAOIs because it can be fatal. We also want to monitor the amylase lipase because they can increase, especially if our patients have poor liver function. Now, patient teaching includes, as always, teaching signs and symptoms of allergic reactions. We want our patients to know that this can cause dizziness and drowsiness, so they need to be extra careful when getting up and ambulating or to call for help. We want to instruct our patients how to avoid overdosing on this medication. We want to monitor for respiratory depression. We also want to let our patients know not to take this medication with alcohol or any other over-the-counter medications like Benadryl or anything that may say PM on the end. We also want to teach our patients to avoid orthostatic hypotension by changing positions slowly. That they should also not be used for an extended period of time because there is a risk for dependency. And these medications can also interact with benzodiazepines and other CNS depressants. We also want to teach our patients that they should stay hydrated and take stool softeners to avoid constipation. So that's it for this week's Med Monday. I hope you learned a lot. Make sure to sign up for Med Monday at NursingSchoolSimplified.com/Med Monday. I'll send you the slides every week as well as a fact sheet. So until next time, have a great week and keep working on your dream.